Welcome to the Dermlin clinical series on wound care management. It is a distinct privilege to present to you some of my personal experiences on the use of this remarkable wound care treatment. This is Dr. Josefino Sanchez, a vascular surgeon with more than 30 years of experience in treating complicated, non-healing wounds in diabetics and patients with vascular problems. This is a case of a 65-year-old male who presented with 2 months history of weeping, foul-smelling stasis ulcer on the left lower leg along the medial malleolar area. Past medical history revealed dependent leg edema and relieved by leg elevation. History and PE clearly established this condition to be one of the long-term sequelae of chronic venous disease leading to chronic venous insufficiency, a relatively common vascular problem that is unrecognized clinically. Venous pathology develops when venous pressure is increased and return of blood is impaired through several mechanisms, including valvular incompetence of the axial, deep or superficial veins, perforator valve incompetence, venous obstruction, or a combination of these processes. Muscle pump dysfunction also contributes to venous pathology. These mechanisms induce venous hypertension, particularly with the standing or ambulation. For this reason, the CEAP classification was conceived to comprehensively describe and stage venous varicosities. Our patient would be CEAP 6 based on this classification, which indicates a severe stage of CVI. Ultrasonography is performed in the office of the posterior tibial, popliteal, superficial femoral, and common femoral locations, and also along the course of the greater saphenous vein. In each location, the vein is checked for patency and valvular competence. Valvular competence is observed both with the Valsalva maneuver and with local compression maneuvers proximal to the site that is being interrogated. Endovenous laser ablation avoids the need for stripping of incompetent vein by using laser energy to denature the vessel wall in situ, resulting in destruction of the intima and collagen of the media, leading to fibrotic occlusion of the vein. Energy is delivered both directly to the vein wall by the laser fiber and indirectly from steam bubbles produced by boiling of a small quantity of blood inside the vein. After EVLT, the GSB reflux and the venous hypertension has been eliminated, thus promoting the healing of the stasis ulcer. This is the ulcer 1 week after EVLT and twice daily wet to dry dressing with wound irrigation solution and Dermlin paste application. This noticeable granulation in the ulcer base and edges with an overall decrease in ulcer size. Leg edema has disappeared and skin erythema and texture has improved. This is after 1 month. The very grateful patient came back with completely healed wound, fully ambulatory and pain-free. Applying the TIME concept of wound management, 4 factors of local wound environment have to be considered to optimize wound healing, namely tissue management, inflammation and infection control, moisture balance, and epithelial advancement. Moisture balance is essential to promote healing and protect the peri-wound tissues from maceration. The concept of moist wound healing has long been established, but despite a plethora of modern moist dressings, there is currently no evidence to suggest that any one dressing is superior for a chronic leg ulcer. Dermlin is a recently introduced wound healing agent with an innovative formulation. Calcium has been established as an active agent in hemostasis, epidermal cell migration, and regeneration, which are important components in wound healing. Calcium-based nanoparticles rapidly decrease open wound size by contracture mediated by release of ionized calcium upon disintegration of pH-sensitive calcium nanoparticles in the acidic wound environment. The combined silicone gel decreased inflammatory reaction and improves wound recovery index. As a result, wound healing is facilitated by active stimulation, proliferation, differentiation and migration of epithelial cells, growth of granulation tissues through fibrin synthesis, and decreased scar formation due to faster type 4 collagen growth. Its nano formulation stops bleeding and exudation and prevents infection by inhibiting bacterial growth. In this histologic section of superficial partial thickness skin burn after Dermlin treatment clearly showed little hyperplastic granulation tissue. Thus, scarring is minimized and stable epithelialization is enhanced. It is simple to use. After achieving a healthy wound base with minor debridement and daily wet to dry dressing, a very thin application of Dermlin healing paste was done on this patient. When confronted with non-healing wounds, proper vascular evaluation and wound care should always be done to make wound healing possible. I have tried a lot of wound healing agents before, but nothing comes close. For faster wound healing, choose Dermlin. It never fails to impress me. Thank you for sharing your time and attention.